All right, I think we are live. Anyway, my name is Brent Agin. This is Q&A with Dr. A. I'm a functional medicine doctor. If you guys haven't tuned in or have not heard me talk, thanks for listening. And as what I always try to bring, good topics that can impact our lives in a positive way. If anything, you can take out of this is just thinking that everything that we kind of bring as far as discussion points or things that you guys want to hear or things that I find are repetitively brought up in my clinic, and so I just want to shed some light on some of these topics. As you know, this is sponsored by TeleWellnessMD, and that is a lifestyle online telehealth company that really has has a lot of products and a lot of opportunities for people that are trying to improve their quality of life, their health, their well-being. And unfortunately, we don't have a lot of opportunities to get these types of solutions in traditional healthcare. So that is why we created TeleWellnessMD, and why we have these conversations are so you guys can get a little bit of different perspective than you might get when you go to a traditional doctor. Just a little background: I've never practiced in a traditional medical practice, so this is all something that I have basically accumulated over the years from other physicians, from listening to patients, from using products on myself, and it really allows me to speak to you guys in layman's terms, but to really express the importance of some of these treatments and some of the things that you can do to just feel better and live a higher quality life. So today our topic is sexual health, and you might not really understand the importance of sexual health, so I want to shed a little light onto it, and it also is going to kind of connect into lifestyle, connect into overall health. Definitely going to, hopefully there's some things that might not be alarming. You might actually predict some of the things I'm going to say, but there is a huge tie into sexual health and well-being. And then we're going to talk about some solutions at the end. But first off, let's just get into the details of why are we talking about sexual health. And I like talking very, very common sense, very logically, really getting down to the basics about health and wellness. And so the most important thing you can think about why we're going to talk about sex is because there's tons of research. It's been done for years and years and years about the correlation between good sexual well-being or good sexuality, sexual health, and how that correlates to happiness. So that's it. That's all you got to think about, because a lot of what lifestyle medicine is, it's all about happiness. It's about getting people to understand that they're in control and they are in charge of their happiness. And if you're not unhappy, if you're not as happy as you are, then what are you going to do about it? That is up to you. You're the one that's going to be the driver of your happiness. And it just happens to be that they have done research over and over and over again, and there is a direct link between sexual satisfaction and happiness. And it even goes beyond that and saying not just happiness, but actually well-being, which, wellness is, that gets into spirituality, productivity, physical health, mental health. And so you can see that and you can see it in the movies. A lot of times when in the movies they depict these people coming in the morning and they're like, oh my gosh, why are you so happy? And these people are smiling, they're glowing, because guess what? The night before they had an amazing sexual experience, and then they're still benefiting from that hormone release, from that psychological celebration in the mornings, and they're still glowing from a good sexual experience. And that happens in both men and women. Sometimes they say women are a little bit more of the emotional, take away more of the emotional side of it, and might carry a good sexual experience for days of happiness. But the whole idea of saying, hey, why are you so happy? Why are you in such a good mood? And it tying back to sex is a normal, innate, primate, animal type instinct that we have. When they talk about instinctual things that animals do, they sometimes, there's a lot of different natural instincts, but one of the three big ones that people usually talk about are the 3 F's or 4 F's, which is fear, feeding or food, and then fornication. And so obviously as animals, if you've ever been to the zoo during a I've been to the zoo, San Diego Zoo, with my kids, and you know, we had a family vacation out there with some other families, and it happened to be mating season at the San Diego Zoo. And let me tell you something, when you have, you know, 6, 7, 8-year-olds running around, and at every display of animals you have sex going on with zebras, and it was wild, but it's just saying that, you know, that's what we are. We're animals. And so you can see how in the animal kingdom this is a huge part of what drives animal instincts, and it's no different than for us as well. And so, but the problem is that even though it's that important, and we know that the research shows that sex ties into to happiness and well-being, we're on a consistent downward trend in the United States as far as how our sexuality is. And so one of the questions I was going to ask, and I was going to see what people surprisingly would come up with, is what country in the world, what country has the most sex? And if you're thinking the United States would be up there, you're crazy. But hopefully you guys actually think, no, the United States has got to be down at the bottom. And I'd be interested. I wish this was a podcast so I could listen to people's reasonings why. But I'm just interested to see what country pops into people's mind. And so I can tell you, number one on anywhere you're going to look, number one is going to come across as Greece. Yes, Greece is the number one most sexual country. And then it kind of trickles down. I want to actually make sure that I give you the right number. So it goes Greece, Brazil, Russia, China, Italy, Spain, Poland, Malaysia, Switzerland, Mexico. Those are the top 10 most sexually active countries. In the U.S. comes all the way, and this is out of the countries that were polled. The U.S. came down second to last, only with Japan being the lowest. So think about that. U.S. is the second least sexually active country that they polled, and it was 100+ countries. So don't think it was just, you know, 20. But you know, so hopefully you guys thought about that and actually had U.S. at the low point, because it also ties into health. So you can think that there are a lot of factors that we're going to talk about that affect sexuality and sexual well-being, but you know, health is going to be obviously one of them, but there's other ones. The other big statistic is that in the United States, only 50% of people are satisfied with their sexual health, or their sexual well-being, their sexual health, their sexuality. Less than 50% of people are satisfied with the amount of sex they have, the type, quality of sex they have, whatever you want to say about it. That's, you know, that's another striking statistic, and that's just in the United States. But then what you found is that in the United States, in the last 3 years, there's been a downward trend in overall sexuality, and this in 2018 was the last time that I found a statistic, and it showed that 1 out of 4, 25% of people that were surveyed, and this was thousands and thousands of people, 25% had not had any sex, at least with another partner, maybe masturbation or something, but no one, 25% had not had sex in a year. And so that's 1 out of 4 people, you know, that were adults that had not had sex in a year. And what was striking about that is that a quarter of that 25% were in the age group from 20 to 29. So you would think that that is the age group that's having the most sex, but actually they're starting to become one of the more celibate, and they're dormant in their sexuality. But of course you can say is one of the factors that tie into decrease in sexuality is age. And yes, we are at a point where the baby boomers, that 60-year-old age group and above, are starting to make up a larger percent of the population. They've jumped from like 13 to 26% of our population in the last 10 years, and are going to continue to grow. And so yes, age does start to become a factor, but as you looked at the one stat, that was saying that the younger generation was also not having sex. So when you tie this into kind of our whole kind of situation that we have in the United States, it starts to become, you know, you start to become a little bit more awake to what is happening in the direct correlation between our health, our happiness, our sexuality. All of these things are, you know, somewhat intertwined. And so when you look at why is the United States not having sex, not happy, you know, in a mental illness crisis, one of the unhealthiest developed countries in the world. We're 46 as far as the most unhealthy countries in the world. Some people will argue that. but it's way down there. So we prescribe more drugs than any other country. So you can kind of start understanding the problem. We are an unhealthy society, and you can imagine if you're not healthy, how can you start really considering wanting to have sex? And sex is tied to happiness. So you can kind of just figure this whole thing out, that now you're basically saying, well, if I get healthier, there's a good chance I could have more sex. And if I have more sex, that's directly tied to being happier. And you can see you're in this whole big positive cycle. So at minimum of what you could take away from today's discussion is saying, well, if you're not really interested in sex right now, if you're not having sex, if you're not interested, or you're not having it, or you're having it and it's not really rewarding, it's not anything that you're proud of, you're not satisfied with it, then there's your number one answer. Is you got to sit there and say why, because that's tied to happiness. So then you could say, well, are you happy? Now, if you're happy and you're not having sex, you're like really happy, and you're really looking in the mirror and testing yourself to say, are you really happy? And you're not having sex, that's fine. Or if you're having bad sex and you're happy, that's fine, because happiness is the most important thing in this world. Is that if you're happy and you get up every day and you say, gosh, I'm happy, life is great, then it doesn't matter what quality sex you're having, just keep doing what you're doing. But if you're not able to say those words, if you can't mutter those words that I am really happy, then one of the things you can start to look at is, well, am I having sex? Do I want to have sex? Could I have sex in the future? Is that part of my wellness plan that could impact me in a positive way? And so, if you're in relationships out there and you're one of these people dragging down the United States statistics by not having sex, then you got to sit there and think about, why is that? Why is the United States not having sex? If you're one of those couples that are not doing it, then, and you can sit there and say that you're super happy, then fine, you can move out of the conversation. But if you're not having sex and you can't sit there and look yourself in the mirror and say, God, I'm really happy, I just am super happy with life and everything, then now you have something you can start working on, because there is ways that you can start to spark up that sex life. And when you know your sex life is starting to spark, that means that you're probably getting happier, and that probably means you're moving in the right direction, because you're making better choices. And when you make better decisions, life goes in a different direction. So let's take a little look at why we're not having sex in the United States. I already talked to you about health, but health isn't, I said age first, and yes, we are an aging society right now, just because of the certain percentage of men and women over 60 years of age. But guess what? In my world, in my clinic, 60-year-olds are still having amazing sex lives. The people that come to me are not going to traditional doctors. They understand that they're not necessarily going to get the answers that they need to really spark up and keep them sexually active for as long as they, as long as their health span. And so, by saying health span, just remember, our lifestyle medicine is about health span. It is about living as long as you can while you still have your faculties, you're still healthy. Not lifespan. Lifespan is how long you live. We're talking about how long you live healthy, and healthy means that you could be still having sexual activities. And so age is not really a fact. It should not be a factor, because age is a decision, not a number. And we have people in their mid 70s that are still very sexually active, very sexually satisfied, well into their 70s. So do not think that age is going to be the only thing that we talk about. So another one, so we talk about, is one of the problems is directly correlated with sex, or with sex in the United States. We talk about is health. And one of the main things with our health is our obesity crisis. So I'm going to talk two things about health real quick, and one is obesity and one is mental illness. And there is a tie into both of those, but both of those have a huge impact on our sexuality. Because I can understand why it does, but I also don't understand why people aren't finding ways to look around body image, to still be able to use sexuality as a tool, as a fuel for self-improvement, but also knowing how it ties into happiness, to making it a point to try to get it back being active in a relationship. But yes, I get it. Obesity, I mean, if you're not happy with yourself, if you're not happy with the way you look, it is going to be very difficult for you to really want to find yourself getting into those situations and picture that happening. But guess what? There are ways, and and we'll talk about that in the solution part. But I get it. But it also is that if you are not happy and you're not having sexual activities because of your body image, then there is your sign of exactly an easy path to making some change that would get you healthier and also increase your sexuality, which we know increases your happiness. So just think about that. If your body image is something that's limiting you from sexual activities, then you now know one thing, that you should be making a decision to consciously go out and start to at least get your body to a point to where you are happy with it, you're comfortable with it, and so it won't be a barrier for increasing your sexual exploration. So we talked about age, we talked about health and mental illness. Obviously, we're in a mental illness epidemic. I would say pandemic, but at least in the United States, mental illness is a huge driver of decreased sexuality for a couple reasons. One is, if you're depressed, if you're anxious, if you're, you know, it's very hard for you to even start to consider that you want to have sex when you're just trying to get through a day and just trying to get through work and just trying to raise your kids with really poor mental outlook. I get it. And on the other side of it is that a lot of the medications for mental illness also have sexual side effects. So just understand that you know, sometimes when your sexual arousal or your desire for sexual activities doesn't seem to be there, you don't have that spark, sometimes you have to look at medications. And it's not just mental health, mental illness medications, you know, benzodiazepines, antidepressants, you know, these can cause weight gain, they can cause sexual dysfunction, they can cause you to not have an orgasm, but so can heart medicines. And so if you have high blood pressure, if you have other heart medicines that you're on, some of those medicines can also affect your ability to have erections, your ability to be aroused, your ability to have orgasms. And so then you can start seeing that now you're getting into where you might be having sex, but you're not having satisfactory sex because either you can't get an erection or you can't have an orgasm, and then you end up just throwing in the towel and saying, you know, we don't need to have sex. So those are kind of the few big reasons that you can see that there's a connection between why we're having this decline. But here's another one: technology. Now just think about this. In one of the polls that they asked people, they said, why are you having less sex than you used to? And they said, because there's more things to do in the evenings now than there were in the past. So yeah, that makes sense. So what that basically is saying is, just like everything else that's going on with technology that's making people sedentary, they're actually choosing games, Netflix, documentaries, social media, anything other than having sex, which sex has a direct tie-in to happiness, and social media is poison, and so is, well, truthfully, anything that you're doing that you're not having an experience. You know, you have to sit there and wonder how, you know, really what is your use of time when you're choosing those activities over sex when you have sex available. If you're one of those people that could be having sex but you choose to do something else technologically oriented, then you can find out that if you really find yourself in a spot where you don't feel truly happy, then you might have to also put the technology on hold for 30 days and see if you can't spark up your relationship. Because, you know, when people have relationship issues, you have to start really looking at what are the pieces that, you know, and dissecting it out. But if you're in a relationship with really good, you know, satisfactory sexual relationship, you know, usually the relationship has a stronger quality than one that doesn't. And so just remember, sex is an important thing to kind of target as far as when you're really looking at where you are in your happiness. So technology is an interesting one. So we talked about you know, several different factors that can cause you to maybe not get yourself into this position where you want to have sex, but you can also see that there are the technology also goes into relationships also. There is no more relationships. We're in a severe and serious communication crisis. So you know, people are trying to date online. They're using and this is all information that gets brought to me. I do a lot of counseling in my type of medicine when it's lifestyle medicine and people are struggling with you know, they get in a new relationship and have difficulties with erections or difficulty with arousal. You can see that falls into the realm of my type of medicine because, you know, sleep, diet, hormones, exercise all play into this. So I get a lot of conversations about sexuality, and so you know, you just have to understand that a big part of this is that people are not meeting the same way that they used to. you know, it becomes stressful, you know, and then you can start getting anxiety because you're trying to perform. And you get into the psychology of things, and remember, we're already talking about how we're a stressed out society right now. So just a little thought about underperformance can really affect a man's ability to have a good sexual experience. So how do we figure this whole thing out when we understand the importance of our sexual health, but yet we're in a country that is losing this battle. We're losing the battle of happiness in general. And so what can we do about it? Well, basically, if you now know what we just talked about, you have to start doing everything opposite. You can't wait and just expect to get healthy. You have to be very proactive, and you have to go do things about it. But most importantly is if you're having any mental, you know, physical, psychological or physical problem, you know, if you're a woman that has a higher rate of sexual arousal disorder, or if you're a man with a higher rate of the physiological inability to have sex. You know, some women will have vaginal dryness, but mostly women are having sexual arousal. They just don't have the libido or the desire, whereas men are leading the problems, are leading obviously with erectile dysfunction. So, you know, and that's what I was kind of leading into, is with stress. And so you got to think that if you're a man listening, and you're not getting, you know, full erections, you have to understand that stress in the psychology of erections is very, very strong. It's more psychologically involved with erectile dysfunction than physiological, probably 60 to 40. And you can kind of look at it like insomnia. You know, when people can't sleep, just the idea as the nighttime comes, just the thought about having to go to bed when you can't sleep, you already start getting anxious, which then of course causes you not to be able to sleep. That's the same things with erections. Once you have a fear of not having an erection, all you have to do is think about that, and boom, the erection can be gone just like that. If you already have stress on your plate, if you're not sleeping well, if you're not eating, if you're not exercising, and you have stress, and you're going to try to have an amazing sexual experience, and you're limited because of stress and worried about not performing, you are going to have a very high rate of erectile dysfunction. And so now we start thinking about the solutions. And so bottom line is, happiness is number one. We know that it's tied into sexuality. So if you have the opportunity, you're in a relationship, and you have the ability to take away from this, to actually go back and try to spark some some sexual excitement in your relationship, then perfect. Because I'm telling you, you will see that will equate to those movie screens when your scripts, when you wake up the next morning going, oh my gosh, why are we not doing this more often? And you're going to feel good. You release natural endorphins and oxytocin and these chemicals that actually stimulate your brain and give you that reward sensation, which you can carry into other aspects of your life. You know, it's going to make you more productive at work the next day. It's going to make everything better. So don't ever stop in your pursuit of having that component in a relationship, or finding that in a relationship, because we know how important it is. So now when we kind of look at what were some of the causes of decreased sexuality, let's look at some of the solutions. If you're overweight, start losing weight, but do not let it affect your sex right now, especially if you plan on losing weight. If you really have to, don't have sex with the lights on. That's fine. You can still feel, you can still touch, you can still have a great time. But and the other thing that they say is that if you want to have sex and you want to have good sex, you have to start thinking about sex. You have to start thinking about it. You have to start talking about it. You have to start planning for it. Have date nights, whatever you got to do to increase that intensity or that desire to want to have it. You have to work at it. That's if you want it, you got to work a little bit at it. Second thing is, if you're having sexual arousal disorder as a female, we do have a product called it used to be called Scream Cream, but I think they since changed the name. I didn't come up with that name, but it's a cream that you put actually on the vulva, and it's got a few different ingredients in it. One of the ingredients is ergolyl mesylate, which I know increases blood flow and can enhance the mood. It still will absorb through the skin, and it has some other things like I think a little bit of a menthol and some things that will cause tingling and warmth. But they're basically bringing blood flow to the vaginal area and to the clitoris, and so that you can have a better, more aroused sexual experience. There's also a PT-141 or a bremelanotide, which is also good for sexual arousal disorder in women. And this is a drug that they've studied, and it's actually just finished, I think, the 3rd phase trials by a company in Illinois that is going to take it actually into a pharmaceutical for women's sexual arousal. Or that might be for men, but I think it's for women. But anyway, it's been used, it's been tried, and it actually, I think, works better for women, because for men, the report is that it doesn't necessarily give planned erections, that you take it and you sometimes can end up with spontaneous erections, but not necessarily, hey, I take this injection and it causes me to have better erections. It can make your libido go up, but I think that one's still a little bit more for women. And that one kind of goes right into melanotan as well. Melanotan is a product that is UV protectant, so it's used for people to increase skin tanning and also decrease the risk of skin cancer. But it also has bremelanotide in it, so it can cause you to have decreased appetite and also increase your libido. But for men, this is very easy. If you are not having satisfactory erections, you can try Viagra, Cialis, or any of the other oral medicines. They work for a lot of people, but most do have at least some form or light form of a side effect, either headache, blowing of the eyes, stuffy nose. Some people have severe side effects. So if you're one that has side effects, then you go to penile injections. And penile injections are one of those that in my clinic, when I have patients coming in, if I switch them over to penile injections off of Viagra or Cialis, this is 100% satisfaction. These people will not go back to those pills, because these penile injections have been around for 25 years. And it is basically what we would call, do you want to go to 0 to 60 in an hour, or do you want to go to 0 to 60 in less than 5 minutes? And that's kind of what these are. These injections give very satisfied, full erections for up to a couple hours with one small diabetic needle into one side of the penis, one injection. And so obviously very predictable. You can just go to the bathroom and use the restroom. You give yourself the shot, you go back, and you're in the ball game. There's 4 different types. There's bimix, trimix, quadmix, and super quad. So you can graduate it depending on your need. It's a little bit of a project, but once you find out the right dose for you, you will be back performing. And what's really neat with this is that the more erections you have, the more blood flow you have, the better the penis will work long term. And so, and then after a while, you might not even need to have the injections. Just knowing you have them there might actually cause you to start having more firm erections and increasing your sexual satisfaction without even needing meds. And of course, all the while you're using these therapies, you have to be using all of our other therapies to get yourself healthy. That's what this is about. The healthier you are, the more exercise, the more blood flow, the more it works for both men and women. Deep stages of sleep, good diet, good exercise means good sexuality, good body image, good health, good happiness. And so this is the whole kind of tie-in, is that healthy people have healthier and healthier sex lives. And so if that's the real draw for you to get healthy, if you're not satisfied with your sex life and it can convince you to get healthy just because it could improve your sex life and your sexual sexual performance, then great. That is all you need. Then get started, because getting healthy does have its rewards and its benefits. But if you're not at a point that where you are struggling with your sexual satisfaction, then use this conversation as the spark plug to start having sex, because when you have sex, you're going to want to have more sex, and that's going to get your mindset to say, you know what, let's get healthy. This is good. This is fun. I like this type of activity. We should be having sex 2-3 times a week. You shouldn't get into that statistic that is dragging the United States all the way down to almost the bottom in sexual activity. So do the country a good and try to increase our numbers and get that statistic up, because the reason other countries are having more sex is because they're not one of the sickest countries in the world. And so you just think about that. Why is the United States so sick? Why is the United States not having sex? Why does the United States have some of the worst mental illness? And think about how you can take all of that and change it in one decision, which is get healthy, improve your lifestyle, improve your, in one step at a time. This isn't a rush, but don't not have sex and wait till you're completely healthy to say, okay, now I'm ready. Because if you start having it, that's just going to be a huge motivation for you to just keep getting healthier and healthier, so you can keep making your sex better and better. Makes sense, right? So hopefully there's a good tie-in. I'm trying to think if there's some other products that are really good for with sexuality, but I just know that bremelanotide, melanotan, penile injections, Viagra, Cialis, the Scream Cream or Sensual Arousal Cream. And if none of that's working, you know, you can obviously also consider something like HCG for men. That's a FDA-approved fertility treatment. There's also Kispeptin and Gonadorelin that can also help with libido or sexual arousal for women. You know, hopefully soon here at TeleWellness we'll actually be getting into hormone replacement as well. So that means testosterone therapy for men and women. That should be coming next year. There's just a little bit more of regulatory considerations that we have to think of, but we're going to be there. So anyway, overall, that hopefully you got something out of this, because you know, it's kind of interesting to see where we are as a country, and I see this every day. You know, at least I get people coming in to see me that are really excited and really trying to get that sexual spark back in their relationships, and when that happens, you got a happier client. And so I watch this happen all the time when people start really engaging in sexual activity, and so it just turns their lives back around. Because, you know, as we age, that's what we kind of forget. When we're young kids, we're just happy. We don't even think about mortality. We're just happy. And then as we get into our teens and 20s and 30s, you know, sexuality and happiness is great, and then all of a sudden we just start to forget that we can be sexual and we can be happy for our whole lives. But we end up getting distracted, we get sick, and our brains start losing the concept that we can still do everything we did when we were 18, 19, 20, you know, up until our 30s and 40s, all the way into our 70s and 80s. It's a decision that you make if that's the lifestyle you want and if that's how happy you want to be. So when you make that decision and you start on that path, the rewards will be plentiful. So hopefully we can continue to help you at TeleWellnessMD. Please let us know if you have any other ideas or discussions you want. I already know that there's one discussion that we are going to hit in 2 weeks, which is gut health. You know, it's so important. I really believe that's the heart of the body, and so I do want to talk about the microbiome and how the gut really ties into disease, even mental illness, and so we can get people feeling better. Anyway, thanks again. I'm Brent Agin with Q&A with Dr. A.